The article focuses on one of the factors to take into account: patient preference, a fundamental pillar of the evidence-based practice in psychology. The available empirical evidence is reviewed along with the association clinical implications and recommendations. In this, followed by other ethical considerations, leading to the discussion for the dilemmas that can arise when working with individual preference. One of the preferences is reading to the activity. They prefer to what happened with the session and how it is carried out. Prefer reading to the therapist. These include characteristics of the professional himself that cannot be changed at the moment, such as age, gender, experience, culture, or interpersonal skills. Certain prefers that his most studied aspect has been whether a person wants to receive psychology or pharmacologist therapy. Just as it is ethical to take this preference into account, so is the requirement to know the existing limits. It is ethical to consider preference, and it is also ethical not to conform to unacceptable patient wishes. The role of the therapist is to explain the reason for the rejections of the patient preference, the flexibility of therapists within limits, and their ability to adapt to the wishes of each patient are as important as knowing under what circumstances and what type of preference cannot be accepted. Using scientific evidence, professional competence as a key, and ethics. It is not about accepting what is proposed, but about building a context of the collaboration in which decisions are made with sufficient information and in consensual manner, heeding the personal resources of the patients.
Found in Web of Science article titled is Ethical Dilemmas in School Psychology. Which dilemmas are most prevalent today and who will prepare our school psychologists to face them? By Mickey et al. 2024. This article emphasized the crucial role of ethical codes and school psychologists, defining the standards and duties of professional conduct. School psychologists frequently encounter ethical challenges due to serving diverse populations with potentially conflict interests. Additionally, schools operate within legal framework, requiring psychologists to navigate both ethical and legal regulations. Studies by Jacob, Tim, and Taylor consistently show that school psychologists frequently encounter ethical dilemmas and often involving competing principles, conflict with legal requirements, and balancing multiple stakeholder interests. While assignment and administrative pressure were common concerns, ethical dilemmas like reporting child abuse, confronting unethical colleagues, and navigating special education decisions were also prevalent. Notably, formal ethics training was linked to feeling more prepared to handle these challenges, highlighting the need for emphasizing systemic ethical decision making in graduate training programs.
And finally, the street article they would want to share what some is what their body is like as place of danger relax anguish age consideration of young people white gender varies clinical setting. They document address self-harm and the self-dentro of trans and gender by Joe. Gender in the context of mental health of gender not conforming Joe. Self-harm rise complex ethic and deontologic insists for its professional such as addressing, aiming, browning, and carrying agreement respect of the agency and autonomy of young people. Cure Views is a promised theoretical framework to address these ethical issues in the mental health of tag and gender wearing young is rackets and communic to how ethical reflecting cultural sensitivity and interdisciplinary collaboration to address the completeness of the human experience in relation to gender and mental health.